I was always interested and probably really quite disturbed about the way in which we cared for people who were dying. And so probably really right from the beginning of my nursing career, there were a number of deaths that really shaped my understanding and thinking that there must be a better way of actually being able to provide the care that we need to be able to provide to people. At that time I didn't actually know about palliative care, and it was after I had spent some time in Adelaide working with the pain management clinic at Royal Adelaide Hospital. And in actual fact it was the clinicians there who introduced me to palliative care, which and I used to spend quite a bit of time going out to Mary Potter Hospice, and then when I was returning to WA it seemed a logical next step to actually go and work for Jane Hospice Care Service, which was a wonderful experience and a very formative experience at an early stage of my career. And that really has shaped my commitment to palliative care. And shortly after joining palliative care, there was the advent of HIV. I guess being involved in caring for many young men who were dying of HIV further shaped my experience and commitment to ensuring that we had appropriate end-of-life care, and particularly in community-based settings. So that almost feels like ancient history telling you that now, but it has been a long commitment. So I guess after being a clinician for many years, and my experience has been not only as a clinical nurse, but also I've done quite a bit of program management in cancer services and also in HIV, that the next logical step actually seemed to be research. And I think if we think about what good encompasses or makes up good quality palliative care, if we have the patient and family in the centre, then in actual fact it's really dependent on robust public policy, education, both at an undergraduate level, but also from a health promotion perspective and a postgraduate perspective, and clinical practice and research. And I was increasingly interested in evidence-based practice, and that's really how I started to get into research. I felt if I was going to be a good clinician and provide high-level care for my patients and their families, then I actually needed to be a better consumer of the evidence. And so that's how I got drawn into research. Well, having taken up the inaugural chair in palliative nursing at the University of Notre Dame is obviously for me a wonderful opportunity, but also it's a fantastic opportunity for nursing. And to be part of a larger program of research, which is a collaborative between the University of Notre Dame, the University of New South Wales, St Vincent's Sacred Heart and Calvary, and the Cancer Institute of New South Wales, really offers a fantastic opportunity to work really closely with clinicians to do clinically based research, but also to work with them in translational research, the way in which we narrow the evidence practice gap. So in terms of the position, it has been great. It presents great opportunities, and I guess what I love most of all is to have a real clinical focus. So to have that academic connection, but to be really grounded in the clinical domain and working in multidisciplinary teams. So I might be a nurse. I very much see myself as a nurse and as a clinical nurse who perhaps has a toolkit with some research skills, and my mission is really to work with clinicians to improve outcomes for our patients and families. CareSearch is a fantastic resource and something, as a nurse I feel enormously grateful to have access to. I'm forever promoting it to nurses not only in Australia, but I love promoting it overseas. It's such a fantastic resource, and I think for a country of our size, it is wonderful to have that point of care information. I think for nurses and as well as for other health professionals, but I'll focus specifically on nurses, we increasingly need to become used to using point of care information, and Care Search is a really great navigational tool to enable nurses to find the information they need, and particularly for nurses who may not necessarily feel that comfortable about accessing information. I think Care Search is it's a gentle environment and a safe environment for nurses to go to and to navigate, and it's great. It's really applicable to practice nurses, to nurses in aged care and the nurses working in the acute care setting. And I think if we're going to improve palliative care, then the critical thing is that we actually make palliative care part of everybody's business, and resources like Care Search will be a very important part of that journey.